Vaccination rates in Massachusetts and the Northeast continue to outpace other parts of the country. And here to explain what it could mean for your family is Dr. Preethi Mehrotra. She is an infectious disease specialist at Beth Israel Deaconess Medical Center. Good to have you.
Thanks so much for having me.
So we have more people. They're going out to local restaurants. Maybe they're getting together in larger groups. A lot of high schools planning to host proms, graduations in the next few weeks. In a lot of ways, it feels like we're acting as though the pandemic's essentially over. Are you comfortable with that?
Well, there's no question that we have made tremendous progress in our fight against COVID, but we absolutely still have work to do. I will say that my comfort does slowly grow as we continue to vaccinate on a large scale. Encouraging other measures for celebrations, though, can help to decrease transmission risks, such as hosting these events outdoors. And I should add a huge congratulations to graduates or for those who are attending prom.
I know, it is kind of really nice to be able to celebrate that in sort of a normal way this year, I suppose. I want to go to one of our viewer questions. Lori sent us this email. She's asking, what happened to reaching herd immunity? 70% had been a target for many months. Now it seems states are reopening at well under that target. Is this safe?
Well, Lori, I wish I could say there was a magic number for herd immunity. We know to help ensure everyone's safety, really the work ahead of us is to continue to encourage vaccination as strongly as we can. And then if an individual is unvaccinated, they should continue to wear a mask and physically distance as able.
So we know that a lot of states are not doing as well in their rollout compared to this part of the country. Does that slower pace of vaccination pose a risk to our public health?
It's true that states and countries are moving at varying paces, and that we know, as I've mentioned, vaccine is critical to decreasing transmission. So anytime there are large numbers of unvaccinated individuals who don't mask or physically distance, there are risks that clusters of infection may occur.
And that's why that vaccination just stays so important. You've been fully vaccinated for months now. Besides the hospital, are there other places where you will still insist on wearing a mask, even if it's not required?
I am fortunate to have been vaccinated early on as a healthcare professional. I think two important points here. First, if you have the opportunity to get vaccinated, please do. Second, with regards to wearing a mask, everyone has to assess their own level of personal comfort and their own understanding of risk, and they should really discuss those things with their healthcare providers. Personally, if I know outside the healthcare setting, if I'm around an individual who is immunocompromised in some way, has an immune system that isn't quite up to par, or perhaps in a very large, crowded indoor space, I might choose to wear a mask.
All right, all good insight, Dr. Mehrotra. Thank you so much for your time and your insight. We appreciate it.
Thanks.